welcome back to Chapter 13 of the Rathus introductory text. In this video, we're going to wrap up our discussion on the treatment of psychological disorders. In the previous video, we examined what psychotherapy is and looked at some different theoretical perspectives for psychotherapy, different approaches, including Freudian and client-centered sort of Rogerian therapy. I think we wrapped up on behavioral therapy, and that's where we are going to pick up now. We looked at classical conditioning, how principles of classical conditioning can be used for treatment of behavioral modifying behaviors. Same thing applies with operant conditioning. We're talking about using reinforcement and punishment to modify behaviors. You see this in schools, for example, through token economies. If children perform certain behaviors, they earn tokens that they can use to spend, for prizes and things like that. Certain behaviors are rewarded the closer you get through successive approximation. Social skills training, we see this, people who are learning new social skills, especially people maybe who might be intellectually disabled, for example, and learning social skills, kind of learning how to operate on their own without the assistance of others. You'll use principles of operant conditioning. Same thing with biofeedback training. And a lot of this is somewhat review. We've talked about, treating stress and anxiety disorders. So any sort of behavioral modification oftentimes will harken back to behaviorist theory. And so a little bit of review, some terms we've addressed before, but just sort of applied into a new context. So if we're talking about behavioral therapy, another approach also is cognitive therapy, kind of the antithesis. One focuses on behaviors, the other focuses on thoughts. So the idea is that this is a type of therapy that we can change people's beliefs or thoughts, or at least the automatic sort of reactive way they think about things, which is sort of a default way. If you can get people to get out of that automatic sort of reactive way of thinking and get them more into reflective thinking, you minimize a lot of the problems that people have, I think, at least kind of between the ears. But the idea is, as a therapist in this type of setting, your goal is to bring your clients awareness to where their thoughts are, and especially if those thoughts are maladaptive or detrimental to their own good, perhaps. And the idea is not only to make them aware of it, but also potentially change it. So it's kind of like, it's reinterpreting things. Like, instead of seeing something as a negative, like, I lost my job, my life is over, changing that thought to, well, you lost your job, but this is a new opportunity to do something you really like. You never really liked that job anyway, so the silver lining is, you can go off and do something you'd rather do instead. Just as an example, one of the founders or sort of fathers of cognitive therapy, or at least one of the more well-renowned, is Aaron Beck. And the idea is, I think I don't know if we talked about this in the previous chapter, but like the ABC of thoughts, of how certain thoughts are irrational beliefs, or what lead to stressors and anxieties and depression and things like that. And I think some of the thoughts we talked about were, needing to be approved and loved all the time by everyone, or needing to be perfect and things like that. Sort of those irrational beliefs that people have that make us sort of miserable when we can't live up to certain expectations. That's a big focus of the Beck sort of cognitive therapy. Again, increasing awareness of that these sort of thoughts they exist, they're maladaptive, and they're really errors in thinking, but it can be easily corrected. We also see Albert Ellis, another big name in cognitive therapy. Albert Ellis he's known for the rational emotive behavior therapy. So again, kind of combining a little bit of we're bringing emotions into the equation now. We're talking about behavior, even though we're in a cognitive setting. And the idea is that we want to seek out any sort of irrational beliefs and modify them. Again, this is very much like Beck's approach, but I think we talked about it in the previous slide. But it's really seeking out irrational beliefs and then changing them, finding ways to replace those. So we've talked about cognitive therapy, we've talked about behavioral therapy, but really the best approach is when we can combine them both. And in psychology, it's not all that creative, but it's called cognitive behavioral therapy, CBT. It really is sort of the gold standard in terms of treating most common disorders like anxiety disorders, depression, things like that. It is the gold standard in the sense that it's probably the most effective approach to psychotherapy, again, because it's addressing both thoughts and behaviors. You can obviously there's a lot of efficacy in just treating one or the other, but you really make a lot of impact if you can address both, and it makes sense. And so obviously most common approaches to psychotherapy now are going to be CBT based, meaning if they're going to have their background is going to be in cognitive behavioral therapy and to some degree. So up until this point, we've only been talking about individual therapy, but obviously there are therapy settings where you can interact in groups, a larger group, rather than interacting with a therapist one-on-one. You work in a group setting instead. And there are some pros to that. There's some pros that it's cheaper. I mean, if you've never been to therapy before, it's quite expensive. It costs, sometimes $100 an hour or more. If you don't have insurance, even if you have insurance, sometimes it can be expensive. You're talking about $25 a visit, and if you're coming every week, that adds up pretty quickly. You also have more experiences sort of in the pool to kind of draw upon, maybe for comparison, that you as the individual, you can see that, oh, hey, there are like 10 other people in this group who are going through the same thing that I am. And same thing that, again, builds support. It's like, okay, well, hey, I'm not the only one dealing with this. And in some cases, like through AA, a form of group therapy, you literally have a sponsor who is your support buddy. And then you have a larger group as well. So it's kind of nice knowing, hey, other people have my back, other people are going through the same thing that I've been through. And seeing other people succeed is also, pretty cool. It's like, it really helps you. It's observational learning. If we see other people succeed overcoming things, we're talking about like group therapy, like AA or Narcotics Anonymous, for example. If you see somebody else be successful in being sober, that can be very motivating to you. And also, again, it's you're learning to practice talking about some of these things and in a safe place. You're learning new social skills in a safe place, like talking about things like, things that make you very vulnerable. That's not very easy. That takes a lot of practice, and it's a social skill that, it ideally is best in a safe environment where other people are not going to judge you, or other people can relate to you at least. The cons, the disadvantages is that, some people find it hard to open up in front of a group, even though, hey, all these other people are going through the same thing as me, it still might be challenging to open up in front of another person. And another disadvantage that's not listed here is that, you don't, even if you're a talkative person, you're still not going to get that same kind of one-on-one time. In a group therapy session where you have an hour between 10, 15, 20 people, maybe you really only get 5 minutes, good minutes with the therapist, and they're addressing your problem directly. So, for some people, maybe that just doesn't quite meet their needs of what they want from therapy. And so, again, it's kind of what your needs are, cost-wise, time-wise, pros and cons. They're both good, but so some different types of group therapy you're probably familiar with or heard about, or maybe even experienced yourself in some capacity. There's couple therapy, where couples will go into counseling either before they're married, during marriage, if they're having trouble during marriage. Some religious organizations will make couples go to therapy, kind of maybe sometimes with a pastoral counselor, depending on your church affiliation. There's family therapy that incorporates, if you have children as well, pretty similar to couple therapy in the sense that it's maybe, at this point though, we're talking about a family, maybe a, family that's already formed, marriage has already happened, maybe the therapy is there to prevent the marriage from breaking up, something like that. And there's also self-help and support groups, Narcotics Anonymous, Gamblers Anonymous, Alcoholics Anonymous are some very famous ones that you've probably heard of before. So we've talked a lot about a bunch of different forms of psychotherapy, and so we want to know, okay, how effective are they? Well, for the most part, pretty effective. People who go into therapy tend to do better than people who do not in terms of like treatment for psychological disorders. However, therapy is somewhat limited. Like, all forms of therapy are not equal in terms of what they can treat and how they can treat it. For example, psychodynamic and client-centered, like Rogerian therapy, is probably not the best idea for people who are dealing with psychosis. We will probably talk about more effective treatments here in a moment. Cognitive therapy is really effective for anxiety and depression, OCD, personality disorders, things like that. There's a lot of research that backs this stuff up. So again, not every therapy, not all therapy is equal. You're going to want to, therapy is going to be dependent upon a number of factors: the disorder that you're seeking help with, the therapist, your own needs. But just kind of know that, certain forms of therapy may not be effective for certain disorders, and some are really effective for others, like we just mentioned. CBT, cognitive behavioral therapy, seems to be very effective for a lot of disorders, beyond just like anxiety disorders, maybe in terms of like self-control, sexual dysfunction, health problems. Like if you're trying to modify behaviors, especially, this is really where it's at. Trying to change social skills or modify certain behaviors, like learning self-control or self-regulation. CBT is a really effective form of therapy. So a lot of efficacy, a lot of research that supports this. In fact, your textbook probably cites some of the research. So check out some of those citations if you want to, be double sure about, hey, how effective is this stuff, or maybe what if you're looking for some kind of form of therapy. Check the citations and see what really works. Check the science; it's pretty cool. So here again, when we talk about therapy is an evidence-based practice, meaning therapists don't just like call themselves a cognitive therapist and just make stuff up. Oh, I'm going to talk about the mind, No, it is something that's been practiced and studied through research. It's been replicated with research. It's peer-reviewed by other scientists. So when we say like this type of treatment, this type of therapy is known for, this is effective for treating, depression or headaches, for example. Like there's research papers, there is documentation that supports this. So again, you probably can find the citations in your textbook or elsewhere, Google Scholar or elsewhere. But see, cognitive therapy known for treating depression and headaches, behavioral therapy, depression, bedwetting, developmental disabilities. I mean, I don't want to go over this whole list, but you can, if you do a quick Google search or Google Scholar, I would say is probably a better place to start if you really want to see the evidence. You can actually find this stuff. It's publishable. It's data. It's in the public record. Here is the typical approach, kind of the pie chart. This is from 2012, so I imagine maybe some of this has changed a little bit, but probably not incredibly too much. I mean, we see cognitive therapy seems to be the biggest chunk of the pie, behavioral therapy, integrated combination methods. So if we just combine those three together, we're probably talking about, we're looking at over 2/3 of the pie just between cognitive behavioral or probably cognitive behavioral therapy, some combination of the two. Psychodynamic used to be a huge chunk of the pie. Now it's a good size, but not quite as much as it used to be. Now, there are some research that also suggests that psychotherapy, at least in the United States, how we think about it is we don't see as much participation for racial and ethnic minorities as maybe like, middle class or affluent, white people. And I think a lot of that has to do with money. Therapy is very expensive. So if you are, poor and black or poor and Hispanic or poor and Native American, I mean, you probably just don't have the access like somebody else does. So, and because of that, it's not just a lack. Poverty is not just a lack of money. Poverty is a lack of resources and resources can be a number of things. Resources can be awareness, just simply lacking the awareness of knowing that therapy could be good for you, where to find therapy. Even if you knew where to find it, if you're poor and it might be really weird and awkward to go to somebody who is a professional and this is a whole other, way of life of living, and if you are an immigrant background or have difficulty with language, I mean, that could be another issue. Opening up to strangers, typically you're talking about counselors, or more often than not, you're probably seeing maybe a male or a female white middle-aged counselor. Not always the case, but if that might be kind of weird for somebody who is coming from a different racial and ethnic background and a different cultural background to open up. So a lot of it, there's a lot of cultural explanations that, maybe someone's had a negative experience or heard about negative experiences from other people going to counseling, or you see something on the news or see something on TV or whatever. There's also some research that looks at specific racial and ethnic groups. African Americans may be reluctant to seek help and may withhold information from therapists. I mean, again, this is supported by research. I don't want to go into all of this. I mean, again, I think it goes a little deeper. I think each racial ethnic group probably has a multitude of reasons why. I'm sure I don't really want to get into the nitty gritty of that. And really, again, I mean, these reasons are not, I'm sure each individual within these racial and ethnic groups have their own individual reasons. It can't be boiled down to bullet points. So, anyways, I can definitely see why it would be kind of weird if knowing, if you're a racial or ethnic minority, kind of counseling from the outside perspective might be kind of weird, might seem a little strange, and there might be other ways of trying to cope with mental health concerns that'll be found in each cultural or each family or each individual. So anyways, quick comprehension check. Let's do a quick comp check on the pros and cons of group versus individual therapy. Write some pros and cons down, and we'll come back when you have some things down. All right, welcome back. I would say the pros of individual therapy is obviously you get the one-on-one time. You get a lot of time with a therapist. The cons is very expensive. It's quite expensive. In fact, sometimes it's $100 or more an hour, depending on your insurance. For group therapy, I would say the pros are, it's cheaper. It's easier to maybe relate because you have other people you can kind of, you can know, hey, this person is going through the same thing that I'm going through. They're sharing similar stories, but also it may be harder to open up in front of other people. So anyways, if your list has something different, that's okay too. If you thought of something different, that's okay too. But just maybe double check maybe the textbook and kind of see how close it is. Anyways, all right, truth or fiction? There is no scientific evidence that psychotherapy helps people with psychological disorders. What do you think? Pause the video, come back when you have an answer. Okay, welcome back. It is, in fact, fiction. There is lots of scientific evidence. A quick Google scholar, if you just look up psychotherapy or psychotherapy depression, psychotherapy anxiety, psychotherapy PTSD, you're gonna find hundreds of thousands of results. Scientific peer review articles, not just like Google articles, not just like Time magazine articles or Vice News or whatever you're reading these days, but actual publications, scientific publications. So you can find it yourself. Okay, now we're going to switch gears and look at biological treatments of mental illness. First, we're going to look at drug therapy. There are a large classification of drugs that are used for treating different psychological disorders. For example, anti-anxiety drugs are obviously used for the treatment of anxiety in the form of benzodiazepines. These are drugs that are commonly referred to, like it used to be called Valium. I don't think it's called that anymore, but they're drugs that are designed to depress your central nervous system activity, to basically calm you down. However, these drugs are very effective, but also very addictive, both physically and psychologically. And in fact, one of the symptoms of withdrawal from anti-anxiety drugs is called rebound anxiety, where all of that anxiety that you've been putting off for a while because of the medication just kind of comes flooding back to you. So it actually might be more intense on the withdrawal period. So these are medications to not play around with, to not consume alcohol with, and to be very, very careful about consuming. Antipsychotic drugs are the drugs that are used to treat psychosis, typically with schizophrenia. These drugs, they regulate dopamine. They block dopamine receptors in the brain because schizophrenia is believed to be an overabundance of dopamine in the brain. These drugs are lifesavers, literally, because before these drugs were invented, people with schizophrenia were locked away and confined to asylums and to mental health hospitals because there was no other way to treat these people other than lobotomies, which we'll talk about in a moment. Electroshock therapy, we'll talk about in a moment. But these drugs gave people a chance to leave hospital settings and seek. Of course, they're not perfect either. They have side effects that are pretty nasty in some cases, but I think it sure beats the alternative of being confined to a cage, at least. Antidepressants, selective serotonin reuptake inhibitors are the most common medications typically prescribed for depression. They're also prescribed for anxiety treatment as well. It's not uncommon to see somebody taking an antidepressant even if they have anxiety. These drugs inhibit serotonin, the reuptake process, keep it in your brain, keep the excess in your brain. And the idea is to regulate serotonin to treat depression. Lithium is used for treating bipolar disorder, specifically for treating the manic episodes. Oftentimes you'll see somebody who's taking lithium also taking an antidepressant and SSRI as well. There's also other forms of biological therapy include electroshock therapy, which is administering electric convulsions to the brain. It is no longer, it's used, but in very rare cases for treating people who are not responding to other medications or other forms of treatment in depression. Now notice this is a pretty safe administration of electroconvulsive therapy. We only have one. We have one conductor here that's going to be applied to a single temple. The person is sedated. They have something in their mouth to bite down on. This was not the case historically, and several decades ago, it wasn't uncommon for people to be held down, to have two of these things applied to their brain while they're awake, may or may not have something to bite down on. So this procedure used to be used for treating all kinds of disorders, violent outpulses, schizophrenia, homosexuality in some cases. So pretty nasty history. It's improved and become much more humane, but it has a pretty nasty history. If you just Google One Flew Over the Cuckoo's Nest, the scene where Jack Nicholson's character receives ECT, it's a pretty hard thing to watch. Even it's a movie and it's still hard to watch. There's also psychosurgery, which is using surgical techniques on the brain to treat mental illness. A very infamous procedure is called the prefrontal lobotomy, where the prefrontal cortex is severed from the rest of the brain. This is a procedure that's actually no longer in use today because of how the long-lasting impact it had on people who survived the procedure. I mean, some people literally died from it. Other people who lived were a shell of themselves, a ghost of themselves. Their personalities were completely changed. It was a procedure used for basically mentally castrating patients who were uncontrollable, maybe too violent or just too impulsive. So there are psychosurgery techniques that still exist today, like the amygdalotomy, gamma knife surgery, for example, still exists, but we do not see the prefrontal lobotomy exist any longer, thankfully. You can actually Google some pretty interesting case studies about this. President John F. Kennedy's sister, I believe Rosemary, had a lobotomy. Not something that's talked about a lot, but if you Google that, you can find some pretty interesting stuff. Okay. All right, quick comprehension check. Which type of psychotropic drugs are used to treat schizophrenia, anxiety, and depression? So schizophrenia, what do you think? Pause the video. Anxiety medications, what do you think? Depression, what do you think? Come back. Okay, it's pretty straightforward, but for schizophrenia, antipsychotics, anxiety, antidepressants, or anti-anxiety medications, sometimes both. Depression, antidepressants. Seems straightforward, but make sure you can kind of understand the difference between the three. Okay, also, the originator of a surgical technique to reduce violence learned that it was not always successful when one of his patients shot him. Pause the video, what do you think? This is in fact true. I can't remember the guy's name. Let's check the guy's name. Hold on one sec. Yeah, Moniz, Dr. Moniz. Yeah, he got shot by his own patient. I couldn't remember the guy's name, but I did remember the story. Yep. It didn't work. The person was pretty upset about the procedure, came back and shot his own doctor. You can look that up too as well in your textbook. All right, so does biological therapy work? You're probably wondering, does it work? Drug therapies are very effective, especially antipsychotics, antidepressants. I mean, antidepressants take a while to kick in, but they do work. Anti-anxiety medications are very potent, so be very careful if you are prescribed or considering taking a medication like that. All of these medications have a lot of side effects, so you need to talk to your doctor about that as well. If you are prescribed any side effects you feel, let your doctor know. Sometimes the side effects in some cases have been known to be worse than the actual medication, the symptoms of the medications they're trying to treat. So CBT, we know CBT can be effective for treating schizophrenia. Research supports that. ECT is known for being a last resort for depression. We don't see it really used as commonly as we once did, thankfully, and it's much safer than it once was. So anyways, that's chapter 13. And with that means we only have one more chapter to cover in our textbook, of the Rathus textbook, chapter 14. So I'll see you on our last chapter. Oh my gosh, it's so exciting. See you in chapter 14. All right, thanks. Bye.